Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, dear student, in your Google Classroom for the fourth class. With you, your lecturer, Dr. Lanis Khadar Muhammad, orthodontist at the POP Department of College of Dentistry, University of Babylon. Today, I will give you lecture 5 of your syllabus, and it's represented lecture 3 of orthodontic tooth movement. In the previous lecture, we're talking about the phases of orthodontic tooth movement and the biological response and what happened in each phase and how it occurred in seconds, minutes, and hours. Today we will talking about three topics include the effect of force magnitude or the amount of force, how it will be effect on tooth and their supporting structure if it is vary in its amount, talking about the effect of force duration, and at the end we're talking about the deleterious effect of orthodontic force if it is present or not, and what will happen to the teeth if it have a deleterious effect. So let us starting with the first one about the effect of force magnitude on orthodontic tooth movement. Firstly, the physiological response of any tooth to the force that will be applied to it, it will be vary and differ whether the amount of this force or the magnitude of the force if it is light or heavy continuous force. So, according to this introduction lines, we will have two amount of force magnitude, light continuous force and heavy continuous force. So, according to the beginning words, there will be a different physiological response if we have a light continuous force and if we have apply a heavy continuous force. So let us see what is the physiological response that will be occur in the tooth and their supporting structure if we applied a light continuous force. When we apply a light continuous force prolongedly applied to the tooth, as we mentioned in the previous lecture, there will be a compressed or pressure side to the represented on the side toward the tooth will be moved, and on the other side there will be a tension side according to the pressure tension theory. What happened in the pressure side or in the compressed side if we applied a prolonged or sustained light continuous force? Firstly, in a few seconds, I mean in the initial phase of tooth movement, there will be a partially compressed in the PD ligament space of the compressed side, and also there will be a partially occluding for the blood vessel present in the compressed side, and so on. The blood flow in this side will be decreased when the tooth move suddenly in its socket. Later on, in a few hours, within hours, I mean, maybe range from 4 to 6 hours, or maybe 4 to 8 hours, there will be a there will be a chemical changes in the environment of the area in the compressed side. And As a result of this chemical environment changes, there will be a cellular activity, different pattern of cellular activity present in the compressed side. This position or this period is represented the lag phase. During the lag phase, there will be no tooth movement will be occur, but there will be a chemical changes and there will be a differentiation for the cells that present within the PD ligament of the compressed side. The cells that are present in the compressed side already in the PD ligament is undifferentiated mesenchymal cell. As a result of the chemical changes that have occurred during the lag phase in the compressed side, there will be a differentiation or stimulation for the mesenchymal cell to be differentiated into a different pattern of cells according to what we need. For example, there will be maybe osteoclast cell, osteoblast cell, cementoblast, cementoclast, fibroblast, fibroclast, odontoblast, odontoclast. What type of cell I need in this site? There will be a stimulation for differentiation of the cell that I will be needed. This amount of the time or duration, which range from 4 to 6 or 4 to 8 hours, it is the time that we will need it to keep the light continuous force apply continuously to the teeth in order to induce the cellular differentiation and cellular activity in the area surrounding to the tooth. I mean in the PD ligament space. This time of duration is called a duration threshold. For human, the duration threshold is equal to or range from 4 to 8 hours. If the patient wear the appliance, I mean the removable appliance, less than this duration threshold, I mean less 6 or 8 hours, no tooth movement will be occurred. So if we need a tooth movement to be occurred, we should keep the force applied to the tooth, sustained force applied to the tooth continuously more than the duration threshold. I mean, should keep the appliance apply force to the tooth more than 8 hours per day. Then the tooth movement will be occur. Otherwise, no tooth movement will be occur. Keep this in your mind. Then, after the activation of cellular activity, what will happen? Then, the tooth movement then will be occur. I mean, during the post-lag phase. How it will be occur? The osteoclast cell that have been differentiated and activated within the PD ligament of the compressed side began to act directly on the bone. This is the bone. On the bone that adjacent and facing to the compressed side of the PD ligament, like this diagram. You can see here in this diagram, this is the site of force application of light force in blue or light blue arrow for the tooth. From the right side, the tooth need to be moved to the, from the left side, apply the force, and the tooth should be moved toward the right side of you. This is the compressed side, and this is the tension side. In the compressed side, after the lag phase, there will be activation of the cells. So this is the PD ligament, the white color, and there will be a differentiated of the osteoclast cell in the compressed side. The osteoclast cell start to attack the outer surface of the lamella dura, or the bone surface directly facing with the PD ligament space of the compressed side. So it will be start to remove this bone from the frontal surface of it. This type of remodeling and removing of bone is called a frontal resorption. The frontal resorption is occur and often only when the osteoclast cells that have been differentiated within the PD ligament space of the compressed side start to remodel and resorption the bone that are facing with it. I mean, by removing or resorb the bone of the outer surface of the lamella dura directly. So it is called a frontal resorption. At the same time, on the pressure on the tension side, there will be an activation for the osteoblast cell, and there will be a apposition of a new bone in the tension side. So this is the what will happen if we applied a light continuous force. According to this diagram, you can see here this represented the tooth movement in millimeter against a time in hours and days. This is represented the point of force application. Firstly, as I mentioned in a second, there will be a change in the blood flow. There will be a decrease. Then during a sudden movement of the tooth in the initial phase, followed by, after hours, followed by a cellular activity, chemical changes, and cellular differentiation and cellular activity in the lag phase. It will be take a short time. Then, after the activation of the osteoclast cell reach to this point, after the activation of the osteoclast cell within the PD ligament of the compressed side, it will be starting the bone resorption of the outer surface of lamella dura that for the bone surface that is directly adjacent to the PD ligament of the compressed side, and it will be result in a smooth tooth movement while all the time that the light force is continuously applied to the tooth and reach, as you can see here in the after 21 days of force application, the move reach up approximately 2 millimeters in its movement, but it moves in a smooth line. This is for the light continuous force. What about happened if we applied a heavy continuous force? What about the response? What will happen if we applied a heavy continuous force instead of the light continuous force? Of course, there will be a difference in the physiological response when we applied a heavy continuous force. Firstly, in a few seconds, I mean in the initial phase, there will be, as a result of a heavy continuous applied to the tooth, there will be a completely compressed for the PD ligament space of the compressed side. This will be result in completely occluding of the blood vessel in the compressed side, and this will lead to completely cut off of the blood flow in this side. The cut off of the blood flowing in the compressed side will be result in after hours result in creation of a layer with a sterile necrosis area of cellular elements. I mean that the area in the compressed side will be necrotic area with a dead cell, and these cells become non-functional. Because of the histological appearance of the cell in this region, in the completely compressed side of PD ligament, as the cell become, their structure will be lost, the nuclei of the cell sometimes shrinkage or sometimes disappear. So this area become a avascular area, and it will be referred as a hyalinized area. Now, the question for you now, if the area in the PD ligament space of the compressed side is become a necrotic area, have a necrotic cellular element in the compressed side as a result of application of heavy continuous force to it. So how the bone remodeling will be occur for the bone in this side, and how the tooth movement will be occur if we have no cell in this area. No osteoclast cell will be present in the compressed side. So how the tooth movement and bone resorption will be occur in this side? The answer for this question is that the remodeling of the bone, the remodeling of the bone that is bordering the necrotic area will be occur and happened by cells come from the adjacent and damaged area. In other words, after the application of heavy continuous force, as I mentioned in a few seconds, there will be complete flooding of the blood vessel and cut off of the blood for this area. And as a result, there will be a creation of a sterile necrosis area of cellular element. This red line in the PD ligament of the compressed side is represented the avascular area, represented the hyalinized area, which is a necrosis area, have dead cell. So this is the tooth. This red line on the left side represented the heavy continuous force. This is the pressure side, and this is the tension side. This is the tension side, and this is the pressure or compressed side. So this red line is represented the hyalinized area. Now, how the resorption will be occur here for this bone to be removed and induce the tooth movement if this area have no cells to be act on this bone? The resorption or bone remodeling will be occur only when cells from the marrow space of the adjacent and damaged bone have been differentiated and pass to remove all the bone in front of it reach to the border of bone that facing the hyalinized area. At this point, the tooth movement will be occur. So, for this reason, the tooth movement will be delayed several days, and there will be no tooth movement occur in it, and take several days. The tooth will be keep or stay in its position without any movement. Then later on, after a days, there will be a stimulation for the differentiation of the cells that is present in the marrow space of the bone adjacent to the necrotic area from the underside area for the lamella dura. Come, this osteoclast cell try to pass from the marrow space, cross the bone, removing the bone or resorption, cause a resorption for the bone, and pass from this marrow space underlining areas until reach to the lamella dura and reach to the hyalinized area in the compressed side and cause removing of it. This type of resorption, because it is occur and start from the underside area to the lamella dura and to the compressed side, it is called a undermining resorption. Now, the question for this now, why in the undermining resorption have a delay in the tooth movement? Why it is delay and not occur light continuous force smoothly after the lac phase? The post-lac phase have been occur smoothly and the tooth movement occur. Why in the when applied a heavy continuous force, there will be a delay in tooth movement several days? I mean, the tooth will be stay in its lac phase several days. Then, after several days, the tooth will be moved. I mean, we enter in the post-lac phase after a days. Why? We have two causes for this delaying. The first one, because the stimulation of the cell that is present in the marrow space of the bone adjacent to the necrotic area in the compressed side take a time till it will be stimulated and differentiated into osteoclast cell. The second cause is the thickness of the bone that will be need to be removed by the osteoclast cell till it will be invade and reach to the lamella dura and necrotic area or hyalinized area in the compressed side of BD ligament. And this removing of the considerable thickness of bone will need a time for it. So after the removing of the thickness of bone and the occurrence of the undermining resorption, the tooth will be jumping from one position to its new position suddenly, and it will be occur slightly with a pain. If we repeat to return back to this diagram of the movement of force in millimeter to days against the days, you can see here that this represented the red line, the application of light continuous force, initially and in the lag phase, and then in post-lag phase, the tooth start its smoothly tooth movement on over days later on. While in the application of heavy continuous force, you can see here, this point is represented the end of lag phase for the light continuous force. And after this point, the post-lag phase starts with the smooth tooth movement. While in the condition when we applied a heavy continuous force, the lag phase will be continue for a days, delay for several days, and no tooth movement will be occur. Why? As we explained previously, because of the undermining resorption, because the osteoclast cell will be differentiated from the undermining side of the adjacent bone from the marrow space, and need a time to remove the considerable thickness of bone till reach the hyalinized area in the compressed side of the PD ligaments surrounding the tooth. Then, after the undermining resorption and removing the bone, the tooth will be jump suddenly a few millimeters or a part of millimeters from its original position to a new position suddenly with a pain, as I mentioned previously. So reach to this point or this position. Then, if the heavy force continue apply to the tooth again, this procedure of undermining resorption will be occur with a lag phase, continue for several days without any movement. Then after the undermining resorption, the tooth will be jumping again to its new position and later on. This is a diagram represented the what happened in heavy continuous force. For more explanation for you, you can see here this is represented the side of force application to the tooth. The force will be applied from the right side of you to the left side. So the tooth will be moved toward the left side. This is the compressed side and this is the tension side. You can see that the tension side is widening while in the compressed side is compressed completely. This is a magnification for the area of the compressed side. The orange represented the roots. This gray line is represented the compressed side of the tooth, which is completely occlude and cut off of blood vessel, and there is a layer of hyalinized area. This is the adjacent bone to the necrotic area. The undermining resorption have been occur when the osteoclast cell have been differentiated and stimulated from the marrow space of the bone adjacent to this area and come to start to causing bone resorption from the underside position to the lamella dura and remove this thickness of bone till reach to the hyalinized area in the compressed side and remove, so the tooth will be jump suddenly from this side to this side and this position suddenly. So this is the undermining resorption. This diagram also may be explained for you, summarize what happened if we have a light continuous force or heavy continuous force. In the light continuous force, you can see the difference between them. In the light continuous force, there will be no hyalinized area in the PD ligament of the compressed side, while in the heavy continuous force, there will be a hyalinized area in the PD ligament. In the light continuous force in the compressed side, the osteoclast cell come from the PD ligament space and start to remove the bone from the frontal side and directly facing with it. So it is called a frontal resorption. While in the heavy continuous force when applied, the osteoclast cell come from the bone marrow of adjacent and damaged area from the underside position for the lamella dura and facing start to remove the bone from the underside until reach to the lamella dura and hyalinized area and causing a undermining resorption. So these are the difference between the frontal resorption and undermining resorption. I hope it is clear for you. What happens for the blood vessel if we applied a light continuous force or heavy continuous force? If we applied a light continuous force, there will be a partial compressed in the area of compressed side, partially occluding for blood vessel. The blood flow, as I told you, it will be decrease, and the oxygen also will be decrease in it in a second during the initial phase. Then there will be a chemical mediator and cellular activity within hours in the lag phase, and then there will be a frontal resorption and end with a tooth movement, smoothly tooth movement in a post-lag phase. While when we have a heavy continuous force have been applied, there will be a completely occlusion for the, or completely compressed for the compressed side for the PD ligament, completely occlusion for the blood vessel. The blood flow will be cut and there will be no oxygen in this side. There will be, in hours, there will be a creation of a sterile necrosis area of cellular element with non-functional cell. And as a result, there will be a stimulation for the cells that are present in the bone marrow of the bone that is adjacent to the necrotic area of compressed side and underside to the lamella dura, and there will be a undermining resorption, and the tooth will be occur after a days because the lag phase will be take several days. Then after the jumping of tooth, the post-lag phase will be occur with a pain. So these are about the force magnitude if it is a light or heavy and what's happened as a physiological response which are a difference between them. I hope it is clear for you. Now we will talking about the second topics of our lecture today. It is about the effect of duration, of force duration on tooth movement. Firstly, let me tell you that the key to producing the orthodontic tooth movement is keeping application of a force or sustained force for a time more than the duration of a threshold. As I explained that for you in the beginning of our lecture. If we need tooth movement to be occurred, we need to keep the application of sustained force more than 6 or 8 hours. Otherwise, no tooth movement will be occurred. So, according to the force duration or according to the rate of decay in force duration, we will classify the force duration into 3 types. There will be a continuous force, there will be an interrupted force, and intermittent force. What I meaning by each one? The continuous force mean that the amount of force with a time, the amount of force with a time will be decline in its amount along its duration of application to some appreciable fraction of its original form from one visit to another. I mean, when we applied a force to the tooth, the force after a days will be decrease in its amount after a time of duration, and it will be reached to a point somewhat represented a type of fraction of the original amount of force till the time of next appointment for reactivation. Then the amount of force again, it will be rise to its original one, but it will be keep in its level of amount and never decline to a 0 point. While in the interrupted force, no, the level of force after the application of force and reach to its original optimum force, it will be after a duration of time, it will be decline, reach to the 0 level. Then after next appointment and reactivation, it will be again reached to its original optimal force. Then after a duration of time, it will be declined to 0 level and continue so on. This interrupting force type is need to activation. It will be reached to activation. Both the continuous force and interrupted force can be produced by the fixed appliance only. By fixed appliance, I can keep a continuous force applied to the tooth, never reach to the 0 level or never decline to 0 level. And also I can produce by fixed appliance an interrupted force that can decline with the duration to the 0 level and then again reactivation in the next appointment after the level reached to the 0. I mean that the wire that I put it for the patient in the fixed appliance is have no activation, have no force embedded in it. So I need to change it with another gauge of wire to give me another type of optimal force and so on between appointments. What about the intermittent force? What I mean by it? The intermittent force means that the force level abruptly will be declined to the 0. How? It will be declined to the 0. This is represented the side of force application. It will be reached to its original optimal force. Then it will be declined to the 0. When the patient remove the appliance from the patient mouth. Then after the reinsertion of the appliance, the force return back to its original optimal force. If we remove the appliance, again it will be declined to the 0 intermittently. What I meaning by this? I mean, when the patient remove the removable appliance, the wires inside the removable appliance still, the active parts, still active, still have the optimal force that I need to apply to the tooth. But the level of the force declined to the 0 because the patient remove the appliance from his or her mouth intermittently. When the patient reinserts the appliance again, the active part spring will again give its original optimal force that I do by its activation. So the intermittent force is occur with a removable appliance, while the continuous and interrupted force can be producing by fixed appliance, while the intermittent force can be produced by the removable appliance. So please keep this in your mind and keep what are the difference between the continuous, interrupted, and intermittent force. In the continuous, the level of force keep the level of force continuously force to a part of the appreciable fraction of the original amount of force, never reach to the zero. In the interrupted force that can be obtained also by fixed appliance, the level of force can be reached to the zero level after the amount of activation in the wire is finished. I can say that when the amount of force embedded in the arch wires is finished, so it will be reached to the zero level. While in the intermittent force, no, the level of force will be declined suddenly to the zero when the patient removes the appliance, but the active part in the removable appliance is still in active condition and still have a active force of its optimal force, so that when the patient reinserts the appliance, it can apply again its original optimal force embedded in the active components. So I hope it's clear that what I'm meaning by each one of these type of forces. Now, about the last topic is about the deleterious effect of orthodontic force. Now, the question is the orthodontic force have any deleterious effect for the tooth and their supporting structure? Yes or no? If the answer is yes, is this deleterious effect is transient or permanent? And if it is happen, which teeth will become more susceptible for this deleterious effect than the other? So let us answer this question and explain if the orthodontic force have any deleterious effect on the tooth. Firstly, if the orthodontic force have any effect on the pulp, or maybe it's have effect on the root structure, or on the alveolar bone height, maybe it's the cause or not causing a mobility of tooth, is the orthodontic force can causing a pain for the patient or not? So let us explain each one. Firstly, about the effect on pulp. The orthodontic force will be cause a transient inflammatory response within the pulp at the beginning of the tooth movement, but it will be disappear later on with the days. But keep in your mind that a large enough abrupt movement of the root apex, I mean sudden movement of the root apex, can cut off or severe of the blood vessel that entering to the pulp canal. So keep this in your mind. The second one, is the orthodontic force have any effect on the root structure? Like the bone remodeling that occur in the bone surrounding to the tooth, the root also will be affected by the orthodontic force, and there will be a root remodeling, and it is represented as normal features for the orthodontic tooth movement. As I mentioned for you that in the PD ligament space, after the application of force, there will be a differentiation for different type of cells according what we need. So there will be activation for the cementoclast cell and also a cementoplast cell. The cementoclast will be cause a resorption for the roots, and then cementoplast cell will be cause a repairing for this root by root remodeling, and this is a normal feature for the tooth movement if it is moved orthodontically. But sometime if the repairing by the cementoplast cell not replace the initially resorbed cementum, it will become causing a damage for the root surface. So keep this in your mind. According to some studies, keep in your mind also, according to some studies, it is explained that the endodontically treated teeth will become more susceptible or more prone for root resorption during orthodontic tooth movement than the teeth with normal vitality. I mean, the endodontic treated teeth will become more susceptible for bone resorption than the normal vital teeth if we applied the same amount of force for each one. Also, with the study, it is explained that there will be a high average response will be occur. There will be a high average of resorption for the roots will be occur if we have one of the following condition in the root of the teeth that applied or subjected to orthodontic force. If the roots of the tooth have a cortical root with pointed apices, they will be more susceptible for root resorption. If we have a distorted root form, they will be more susceptible for root resorption. If the tooth have a history of trauma, also it will be more susceptible for root resorption. If the root apex come in contact with the cortical bone, also it will become more susceptible for root resorption. Also, if we applied excessive or heavy force during orthodontic treatment, also there will be more susceptible for inducing a root resorption. Okay, this represented a deleterious effect of orthodontic force. Now, what about the alveolar bone height? About the alveolar bone height, any excessive loss of the cristal bone height never seen as a complication of orthodontic tooth movement. But if it is occur or happened in some cases, it will never exceed the 1 million. And this will be occur only in the cases of extraction site. Okay, so there will be no complication of on the alveolar bone height of alveolar bone loss as a deleterious effect of the orthodontic tooth movement. What about the mobility? During the application of orthodontic force and during the orthodontic treatment and later on after the finishing, there will be a widening in the PD ligament space if we take a X-ray for the teeth and diagnose it or examine it. This represented a normal feature during and after the orthodontic tooth movement. It will be occur because of the uh, physiological response that happen in the tooth movement. But keep in your mind that if we applied a heavy continuous force for the tooth, this will be lead to, as we explained previously, undermining resorption. And the undermining resorption will be lead to a greater mobility of the tooth. Keep in your mind that if the tooth becomes extremely mobile during the orthodontic treatment, all the forces that apply to the tooth should be discontinued until the mobility of the teeth decreases to the moderate level. Then we continue again with our treatment with light force. With light force. Now, what about the last effect that we expected to occur from the application of orthodontic force? Is about the pain. What about the pain? The pain level will be vary individually. It can be for some person the application of after wearing the uh, force of orthodontic appliance, it will be painful during the first day. Other person have no express of any pain, so it is individually vary from one person to another. But this pain after the first application of force of orthodontic force is a transient, maybe continue for 2 to 3 days, and later on it will be disappear gradually. But keep in your mind that the pain have a relationship with the developing of ischemic area, I mean the necrotic area in the PD ligament space. So if we applied a higher or heavy continuous force, that means there will be a creation of pain for the patients. As we explained previously, that after the occurrence of undermining resorption, suddenly the tooth will be jumping from its original position to a distance of its new position, and it will be occur with a pain sensation. So these about the deleterious effect of orthodontic force and what happen if the orthodontic force applied to the tooth, and if it is have any effect on the tooth and their surrounding structure, and if it is a transient or permanent effect. So these are all the information about the orthodontic tooth movement and what happened with it during the phases of orthodontic tooth movement. This is the end of our lecture today. Thank you very much for your attention. And so thank you very much for your attention, dear student, and goodbye to the next